So the necessary conversations, it's not a necessary conversation, they're critical conversations that we're going to have over the next 3 weeks. The West Center Community Healthcare and Care and Prepare have put together this program because we know the importance of advanced care planning and talking about hospice and how to have those conversations that are effective. But we also know how hard it is to start the conversation and just have the conversation, to put paperwork in place. So we're going to hopefully help you along that process and support you through that as well over the next 3 weeks. For the CE credits, for those of you that are wanting to obtain CE credits, we are offering 3 CE credits, but it's 1 credit per program. And that's for nursing, social work, and licensed professional counselors. We can also do a certificate of attendance as well, if you're interested in that. You do must attend the live program and be here for the full hour. We're not able to give any credits off the recording, but for the live program. In the evaluation, or excuse me, the follow-up email you get this afternoon, there will be a SurveyMonkey link for an evaluation of the program. Once you complete that evaluation, you will receive your certificate in the email that you provide within 5 to 7 business days. But you do have 30 days to do the evaluation, and then the opportunity to get CEs after 30 days for each program will be closed. Hope that makes sense. This will all be in the email as well. And just as a quick introduction, I am Jamie Cobb, and my colleague here, Holly Glover, is with me as well. And we are with the James L. West Center for Dementia Care. And we are a not-for-profit organization that serves persons that are impacted with dementia, those that have the diagnosis, but also their families and the community at large. We do education. You can see dementia and caregiver education in the community for families, for friends, for future and current healthcare professionals. And we try and provide our programs free of charge, especially for families and friends. We are able to offer respite care in our residential care. So residential long-term care we provide in our building here in downtown Fort Worth, and we can do respite care. We also have an adult day program. It is currently closed right now, but we are actively looking about reopening options for that. And hopefully we got some news to share in the coming future for that. Do we have, I want to share about community health care. Erin, did you want to share about community health care, or would you like me to do that?
Sure, I can. Community health care has been serving the North Texas area for the last 25 years. We were developed as a nonprofit by several of the hospitals 25 years ago. And our mission is to provide compassionate care for those living with a terminal illness while providing support for their family. And we do that through our team of nurses, social workers, nurses aides, volunteers, spiritual coordinators, and our attending physicians. And our goal is to provide that care wherever the patient calls home, whether that's their assisted living or nursing home or their actual home. Wherever is their home, we like to provide that care. And we do also have 3 inpatient units where we're able to help when we're able to deal with an acute crisis, when we're not able to provide that at their home. And one other thing I want to share is that we have a very extensive bereavement program available to everybody in the community for dealing with grief.
Thank you, Erin. And I just dawned on me. So community healthcare has some space in the James L. West Center. And we kind of get confused often about, that's the James L. West Hospice. Well, it's community healthcare hospice, and they just rent space in our building. But that's not a bad thing that we get confused, because it's always, we had said, just raving reviews. So we're okay to get confused sometimes with community healthcare. And then I'll just turn it over to Leah. Leah's with Care and Prepare, and she's actually going to be presenting the information today about advanced care planning. But Leah, if you want to briefly talk about Care and Prepare.
Well, thank you, Jamie. I really appreciate it. And that is a wonderful facility that community has there at James L. West. If you haven't seen it, you really do need to treat yourself to the tour. It's just an amazing resource for our community. So Care and Prepare has been around for about 20 plus years, and we engage both individuals that are healthy and those that are really facing a serious illness or injury or disease process, and help them understand their healthcare rights and responsibilities. We do that by stimulating end-of-life conversations, a lot of times through education. And our dream is to be able to make some new technology available to the state of Texas as a registry. So those are part of the exciting plans that we have. And I'm going to attempt to share my screen.
And I will let everybody know we're going to have a little bit of time at the end for Q&A, but please feel free to also use the chat as well, and we will hopefully address all questions and concerns here in a minute.
Yeah, so thank you so much, Jamie. I really appreciate your inviting us to be a part of Necessary Conversations. My name is Leah Wingard. I'm your friendly native Fort Worthian. The bulk of my career has been with Cook Children's, and I create compelling messages for nonprofits. I've been with Care and Prepare now for about 3.5 years as their executive director. And like I said, we love to hold educational events. Typically, that's a great venue for us to help people understand how to live well all of their days by processing through what some of their goals and wishes are. So thank you for dialing into the conversation today. I'd like to say that this is the Necessary Objectives file, our slide on the Necessary Conversations. So today we're going to identify why in the world would you want to talk about advanced care planning? What are real world uses? And then describe some of the documents that you need for advanced care planning. We'll also tell you a little bit about new technology that's available and kind of the best way forward in advanced care planning in Texas. And we'll also offer you a chance to practice the application, real world application of this information, and help you choose your champion, because it's the first step that you can make in the advanced care journey. All right, having trouble changing slides. There it is. So every good story starts out, well, every good presentation starts out with a great story. And if it's going to be a really good story, let's put you into the story. So let's imagine that Saturday night, you and your beloved, or you're going to go out to, someplace special so you can celebrate your anniversary. And the plan is to get there early and to take things slow all night long. Unfortunately, when you get there, it looks like it's everybody else's anniversary too. Why? All right, so that's the situation. Now here's the question. Would you allow the chef to prepare whatever he or she wanted to for you to eat? It's a fancy word for this. In Japanese, they say omakase. So how many hands do I have for let's go omakase on this? 100%? Wait a minute. Okay, I got 1, 2 hands maybe. I don't know well, I forgot to tell the rest of you the Yelp ratings are just off the charts, but you're probably right. We should probably tell them about your shellfish allergy and no raw onions or cucumbers whatsoever. Now that we have those caveats, can the chef who's well-trained in the culinary arts, can he or she use all the best ingredients in-house and whip up your order tonight so you can get there quickly? Is everybody in? No? Clearly we have some control issues. I mean, not you, your partner, obviously, it's your partner. Okay, now that's a real world example of a Saturday night that might happen. But what if we change just a couple of variables in the situation? What if instead of you're going to the hot new place to eat, what if you find yourself and your beloved headed to the ER? And for some reason or another, your beloved cannot speak. Now, do you still want the chef's daily special? your loved one needs an advocate who knows what they want. And someday maybe you will need someone to speak for you. Today we're going to help you take the first steps to choose your champion. And legally speaking, when you choose your champion, that's a medical power of attorney that you would be choosing. But let's look back over our story on Saturday night and think about something. Can you think of some ways to avoid some of the, I don't know, unwanted consequences of your dream scenario that you experienced in this imaginary restaurant? Like, did the dream date go as planned? Was there maybe a lack of planning? Yeah, maybe we could have made reservations. So if we flip the script again on our Saturday night and thinking of those things, could any of those observations apply to our ER scenario? Like, which ones? You know, we don't want call ahead seating in the ER because, you know, something really bad has happened. But if it did happen, wouldn't it be better to be prepared for a situation like that? Well, today we hope to walk you through some information that will help you be prepared for one of those worst case scenarios. So we're going to look at what are the steps. There's basically 5 steps. And one is thinking about how you would like to receive care. Now, this is in case you have suddenly encountered an illness, an injury, or disease with which you're not anticipated to recover from. And what is going to be the best quality of life for you? Thinking about that, as well as starting a conversation with your family or friends, and then deciding really who's going to be your champion, who's going to advocate for you. And when you have that crystallized, then you start a conversation with your physician and then document decisions by completing the necessary documents. So many people get really overwhelmed when they think about this. So today, how about if we just knock out, you know, step number 1 and just choose who's going to be the advocate for you, who's going to be your champion. And that really is your medical power of attorney. Now, advanced directive is kind of a broad term, and it can apply to several different kinds of advanced care planning that you would make for your future. And it gives you kind of several ways to express what your preferences are for your care. This process and these documents, it will also guide your family and physicians on how to care for you. And then finally, if this is a very serious situation, you know, out-of-hospital DNR might be helpful for you and your family. So those are the 3 documents that we're going to look at. And next, we're going to go to choosing your champion. This is the person that's going to speak for you, and it's going to advocate for you when you can't speak for yourself. Now, there's several different kinds of power of attorney, and it's easy to get confused on something like this. Just know that this is not the same. An MPOA is not the same as a POA. You can do an MPO today, but for power of attorney, like for financial and things like that, you'll probably need to see an attorney. And if you need, we have people that are part of our board and that can help you, and we'll make some information available to you if you'd like. So who can be an agent? Who can be your champion? Who can be the person that you can go to? Let's say that you have a son or daughter that's 17 years old, they're a child prodigy, thought deeper about the mysteries of the universe than you ever imagined in your entire life. Is that person a good person for you to be your champion, to be your agent? Well, unfortunately, no. You'll have to wait a year. You need somebody that's at least 18 years of age. It can also not work for you unless they're a family member. So if you're in a hospital or home health or clinic of some sort, they can't sign to be your champion unless, of course, they're a family member. Now, some people at this point might be thinking, oh gosh, this sounds complicated. I don't know if, I really know who I want to be my champion. I don't know how to fill out this form. I think I'll just skip it. And I would say, well, that is one choice that you're able of making. But if you don't make the choice, guess what? The plan from the state might not be the plan that you're looking for. And you say, well, what plan do they have? I'm glad you asked. So under Texas law, you've got to have somebody to speak for you. So if you haven't designated it, then the first person that they're going to look to make this decision is your spouse. And that might be okay for you. But if you're in the middle of a messy divorce, do you want this future ex-spouse? Do you want them saying, yeah, no, withdraw all care. We're not interested in prolonging this. Yeah, that may not be the person. So this might be a great time to update your MPOA so you can choose your champ right away. The second person that they would look to in this situation, if you don't have your MPOA in place, is an adult child. Now, if you only have one child and they're, very stable, honest, wonderful person, that might be great. If you have 3 children that bicker all the time, you might want to fill out that paperwork this afternoon. The third person that they would look to is either of your parents. Your parents may not be living, or they might not be able to agree on anything. Another reason to fill out the paperwork. Fourth, you might have said something in passing to your attorney that you wanted your attorney to be your agent. So if there's a conversation on record, then that person would be able to do it. The fifth number on the state's list of, this might be the plan for you, is your nearest living relative. Now, this is not consanguinity. This is the nearest. So if your crazy Uncle Al lives 2 blocks from you and your sister that is, your best friend also lives 20 miles from you, crazy Al is going to be making the decisions. So this might be another reason to get your paperwork. Or 6, a member of clergy that you're in fellowship with in a house of worship. So this is a rabbi, a priest, and a minister. And we all know when there's a rabbi, a priest, and a minister, there's usually a punchline involved. And that is a great reason for you to fill out your paperwork, because you don't want to be involved in that scenario. Now, you say to yourself, okay, I get it. This is a great idea. I'm going to fill out my paperwork. But if I do, what are the triggers that, might actually happen for this to go into place? I mean, well, number one, you can no longer make decisions for yourself. Or, you could be unconscious here, or you may not be effectively communicating with the staff. So for example, if you arrived at the hospital and the physician said, what happened to you, or how do you feel? And you answer purple, well, you're in Fort Worth, TCU, we can understand purple is a feeling, it's a way of life. But, too many times on using purple as an answer, you're going to be deemed not able to communicate effectively with the staff. So before you choose your MPOA, you may want to reflect on this. What would be your motivation for making these decisions about the quality of your life? And it's really important to set the table, especially before dinner. It just makes a proper meal just better. It's the same way in having a conversation with your family, a convenient time to talk with them. I have a friend of mine who always at Thanksgiving makes sure that everybody has their, dessert and drink or libation of choice. And she, frequently talks about her advanced care planning, and if anything has changed. When you have that conversation with your family, it's important to ask if they are willing and able to carry out your desires. There's some people, my mom, for example, she would not be able to carry out my wishes. I know that. My sister, I'm confident would. So that is why she is my champion. She's my MPOA. In some families, there's a great divide on maybe religious or cultural understandings. And it may be such that the person that you initially think of, when you ask them if they're able to carry it out, you have to follow up question, will you honor my decisions, even if they're not what you would want? So it's better to ask that now than not. It just makes it so much easier when people have instructions that they can carry out as opposed to decisions that they have to make. There's a big difference. So we've talked about what is a directive to physicians, and it's similar to living will. It's a statutory form that's created by the Texas legislature. And this document allows you to provide information to your champion, to that medical power of attorney regarding the types of medical treatments that you would prefer under circumstances at the end of your life. So, are there triggers for the directive? Absolutely. There are 3 triggers for the advance directive before it would go into play. If you have an incurable condition caused by an injury, an illness, or disease, and that there is reasonable medical judgment that says that death will occur within 6 months, even with life-sustaining treatment. So the other trigger is you can no longer make decisions about your care. You're answering your state of mind as purple. That's not going to work. And thirdly, you're in a hospital setting. So some things to keep in mind. One, a formal written directive is better than nothing, but it's even better to have a complete document. As long as you're capable, you can change or revoke any advance directive at any time, and that can be in writing or just verbally. So if you make a decision today and have a change of heart later, it's not a big deal. And that's also why it's a really good idea to update your advance directives when there's a major life or health change. Also, keeping copies of advance directives and distributing them to loved ones, as well as keeping them on file with the physician. So what do these really come down to? These really come down to questions that are talking about the quality of life. So we have several ways to walk our community through this information. We do a lot of it through CEUs, and we also have a game that we play that is called Hello. And it consists of different questions, and most of them relate to what makes your life meaningful and worthwhile. What sources influence your medical decisions? Is it the latest clinical journal, or maybe your cultural or religious beliefs? Your experience really can impact that as well. COVID-19 changed my mind about some things that I would want or not want. When you have experiences with your families or friends that have become seriously ill or injured, we learn from those. So do you incorporate that into your advanced care planning? I would suggest if you were really concerned about Aunt Mary when she had the heart attack and was put on a ventilator, she couldn't breathe, she was miserable. What did you learn from that experience? Incorporate that into your advanced care planning. And ask yourself, what concerns do you have about completing your advanced directives? So many times I let fear hold me back from doing what I need to do most. But we can empower ourselves and others if we just face the fear. So sometimes the fear is, I got to stay off machines. I don't want to be on machines. Well, put that down as a goal. Or Maybe your goal is to live as long as possible, regardless of quality of life. Maybe that's your highest priority. For me, I want to be pain-free. I'm not into pain. And so if that means that I need to be a little bit drowsy or something, I'm cool with that. I just don't let me be in pain. Some people want to die at home with their boots on. Well, by all means, put that in your advanced care directive. Others, I want to die in a hospital, want to keep that bad juju out of my house, don't want it there. Either way, whatever way, stay true to yourself, to your spiritual beliefs and your traditions, and help your family. Oops, somebody's trying to come in. Help your family honor your wishes. We can't do that if we don't know what it is that you want. Some examples of things that you might put on an advanced care plan is that, you do or you don't want a ventilator, a feeding tube. You may have seen your grandmother have a feeding tube and it just, strung things out. You wanted no part of that. Or maybe your Uncle Bob was on dialysis and it really helped him live a better quality of life. Mention that. There's so many different perspectives that people have, but it is up to you. So if you have lost control of your bodily functions, what do you want help with, or what do you not want help with? After you've completed your documents, this is where you bring your conversation in with your physician. Or if you are working with Care and Prepare, one of our physician advocates, they can actually help you initiate this whole ACP process. But in either case, this information is great for your providers. Make sure that your physician knows your plan, is willing to follow your directives, go over your directives, and also let them know, name a number of your champion, your healthcare agent that you've chosen. And also assure your physician that your family knows who's the agent, know who's the champion, and that they know what your wishes are. So sometimes at the end of life, an out-of-hospital DNR is an appropriate form. And what is this? This is a directive to physicians and is not effective. This is a legal form and it is effective as soon as it is dated and signed by your physician. And it instructs people that are healthcare physicians and acting outside of the hospital setting. So it remains in effect until the person is pronounced, or if this legal document is revoked. So if at some point you say, I don't want CPR, I'm 94, I've got bone cancer, there's no way I want you pounding on my chest and trying to help me be resuscitated, then this is the right form for you. But if at some point you change your mind, as always, this form can be revoked. But it is good to know that it is an option for you or for a loved one. So when we complete the forms, and if you go to our website, I think, Jamie, can you share in the chat our resource, our page? If you go to our website and you click on Choose Your Champion, it'll take you right to the MPOA legal form. You can fill that out and get it done today. As soon as you do that, you can make copies and share them with people. And, this is not a time to be a secret agent. You don't want your plan to be a secret from anybody that's in your care network. You want them to understand what their role is, how they can help you. Putting a copy of this in your car, in your glove box, is a great place. God forbid you're involved in an MVA. I have another friend who keeps this in the top drawer of her nightstand, just because it's there for easy access. And then once again, as we've said, life changes quickly. So update that as things change. You may have a son or a daughter or a spouse that passes away. So how about that 2020? ACP in the time of COVID, has anything changed? A lot of things changed in 2020, but some things did not. Now, like never before, people need to know their healthcare rights and responsibilities, and they need to fill out their paperwork, to be really honest. It's a great day to choose your champion. That's the first step in ACP. If you go to this website here, basically it'll take you right to the form. 2020 really helped us realize a lot of weaknesses that we had in our healthcare system and in other industries, and really how interdependent we are on one another. Care and Prepare wants everyone to have access to ACP planning, and especially to those people in the greatest of need for this information. So how do we get there? We believe we get there by making it plainer in more simple language to help people understand what their medical wishes are and then how to document those, as well as we know that we need a state registry. You see, right now, advanced care planning is pretty much non-existent. If it's there, it's institution specific and it's rarely accessible. But Vinca is a company that is one of our pioneering partners that we're working with, and they can help us make ACP like it should be. It should be person-centered, it should be integrated, care concordant, and accessible. And with this new technology, it will be. All a physician has to do is have your name, your social security number, and they can access your documents. That is the goal. So, whoops. I want to draw your attention to something really quickly. Care and Prepare has been around, like I said, for 20 plus years. We have physicians that have advocated in the healthcare arena, as well as help codify some of the tenets in the state law. So they have been helping volunteers as well as healthcare professionals with education for over 20 years. We are creating a new state registry and are excited that this is a new way that could truly help everyone. How do we get there? Well, we need a high five, to be really honest. I'll tell you, back when I was in college, I was working my way through school and I had a guilty pleasure. I loved Sunday nights. I would watch the British comedies. And as I tuned in Sunday after Sunday, I began to realize, this is something I really enjoy. And I should give to this. I should partner with them because I really love this. We feel like if you go to our website and peruse our resources, that you will see the value that it brings to you. And we would love if everybody in the Metroplex just gave us a high five. We could lick this problem for the whole state. So please consider doing that. It is a very important effort. It is something that is life-changing. If you found this information interesting, if you found it helpful, we're a 501c3, so we do educational programs like this for other groups. So if your church, civic organization has interest in this, we would love to help you out. If you found this information really helpful, we also send out a newsletter on a monthly basis and would love to incorporate you in our list. We do keep people updated as far as changes in advanced care planning. And then, like I said, it only comes out once a month, so we're not going to bombard you. We just don't have the time. But speaking of time, I recently heard a story of a prosecutor who won every single case that he took on. He was so intent on gaining justice for the victims that he began each case by writing the closing argument first. And when I heard that, I knew why he won every single case. Our legacy is the ultimate begin with the end in mind project. And so when I think about that, I say, what do I want people to remember me for? What do you want people to remember you for? Hadn't we better get started on doing that today? I think so. These lyrics to me, I find very haunting and yet very challenging. I heard you die twice, once when they bury you in the grave, and the second time is the last time that someone mentions your name. My hope is today we have inspired you to not only think about what your advanced care plan is, but to execute that plan so that your family has this gift of knowing what you really would have wanted. It makes it so much easier for them to just carry out instructions. We get to decide the legacy that we leave. With that in mind, what if today is your legacy? I'm going to put up a shameless plug for Karen Telshaw Johnson. She usually helps me out with this presentation, and she reviews all my slides for compliance. She's helped me and my family do last will and testaments. If that is something that you need, I know that Karen is accepting new clients at this point, so feel free to reach out to her. But at this time, I would like to just find out if there are any questions.
Leah, I'm just reading in the comments. Vicki said she's trying to digest the fact that she's never heard the nearest living relative is defined by geographic. So yeah, that's sobering, right? That's why planning is so important.
Yeah, because if your weird cousin Al really does live down the block from you, or if it's just a difference of 2 miles between Weird Al and your sister, that could make a world of difference. And so I highly recommend getting your plans in order today. Karen Prepare has actually put together a handbook that will walk you through all of those choices and actually serve as a great reminder to you, as well as you can put it in your file. We've even made document storage weatherproof bags for people in the past. So just some ideas. Like I said, we are putting together a program called ACP for All, and it is our facilitators embedded into physicians' offices and just helping people walk through this information as well as documenting it. And we're teaming up with Vinca Healthcare. At the end of this month, our goal is to kick off our beta site. And in that, we'll have a facilitator, we'll have the EHR, and we'll have the patients in Dr. Barker's office. Some of you know Dr. Jerry Barker. Wonderful guy. He's going to let us work out all the kinks in his office. So there's no screw ups from there on. But this is a very exciting program. And like I said, we're thrilled to be able to start bootstrapping this and putting it together, and could use some help from anybody. But we feel like that this is great information and wanted to make it available today to you guys.
Julie, there is a question in the chat. Is there a list of qualifying relative with regard to nearest living relative? Is there a list?
There is a list in the statute. I can send you those.
Okay.
So,
great.
Yeah. So yeah, I know not too many people read Texas statute law, but it's great if you have trouble sleeping. So I just want to mention that. If you ever have a need, you won't need drugs, just read this stuff. It doesn't make sense half the time. So
yeah, I'll make sure that statute gets put in the follow-up email for those of you that would like to read that.
Yeah.
Leah, I wanted to add something real quick. I know so many times we think that we need to get this all filled out for our parents or for our older adults, but like you've been saying throughout the entire thing, do it for ourselves also. Do it for our adult children. And that's hard to think about. But if you're 18 or older,
Yeah.
like you stressed, if you don't want the state making your decisions for you,
Yeah.
you need to have these documents in place. Yes, it's difficult to talk about. It's even more difficult to talk about when a decision's having to be made in the hospital.
Yeah, that's really the worst place that you want to make a call is an ER when you're under pressure, you're not thinking clearly, and you've never had this conversation before. That's the last place you want to make that kind of decision. It is the best place to screw up. So don't do that. Yeah, if you don't put your oxygen mask on first, you can't help other people. So I say don't ask your parents to do this if you haven't done it yourself. It's very difficult to grapple with your mortality. I mean, it's like, we all think, I'm probably going to live forever or, a good long time. And, odds are you probably will. But, a few years back, I was in a really bad car accident. And, thank God I had 3 out of 4 airbags go off. And so I walked away without a scratch. I mean, I got a lot of soft tissue injury. That's a whole other conversation. But if that had gone another way, if instead of having my car upgraded, what if I'd gotten the usual tin can that I did most of the time? What if I was wearing one of those, those little bitty, what they call them, smart cars? They didn't always seem really bright to me, but I don't think they make them in extra large my size. So I'm just saying, if the MVA went a different way and I didn't have the paperwork involved and I was like in Midland, like that's where it happened. I mean, how in the world are they supposed to know? Wouldn't it be great if we had a Texas registry where, you go, okay, type in the patient's name. All right, Leah Wingard, no, backspace, no you, can't afford it. Okay. Social Security, last 4. Oh, Ms. Wingard already has a advanced care plan set up. She wants the most to be done. Fabulous. She's young, she's healthy, we're gonna do it. This happened in 40 years from now, I might be saying, please give comfort care. That might be a better choice for me then. It's going to depend on what I want. But if you don't have an MPOA, or maybe you did your paperwork when you went to a facility once, let's say you just went to All Saints and you had surgery and you filled out a piece of paper there, well, that's great. How are we going to make this accessible in future if you don't happen to end up at that particular provider? The best way possible would be if there was a Texas registry for all. And I think the best way to get that is to mobilize our local community and then begin to pressure our representatives to say, look, this is the 21st century. We should be able to do this. We can do this. And this is the way forward. So I think putting together that plan and just helping people to be informed is really crucial. So please choose your champion today. Don't let the state do it for you.
Yeah, Teresa, you got something?
Yeah, thank you. Thank you, Holly. I'm Teresa. I'm a social worker at James L. West, and I love Leah. We've met before for many trainings. But 2 things I wanted to mention: that if you don't do your own medical power of attorney, living will, or durable power of attorney, nobody else can do that for you. If you were to develop dementia or go to the hospital and not be able to answer, those forms can't be made by anybody but you.
Thank you.
So
I appreciate
when things
that.
like that happen, you want to make sure, I want my sister Jean taking care of me, not my sister Maureen. Jean's a lot nicer to me than Maureen is, and who knows what Maureen's plans are. The second thing I was going to share was, you were talking about where to have the forms. I learned very quickly when I first came to Texas working in an ER, I was trained nobody comes back in an emergency situation but immediate family. What they forgot to tell me was, and anybody who's a minister or priest with that family. So I always suggest to families that they keep a copy and their doctor know what's going on. And then the church knows what's going on, no matter what church it is. Because when accidents happen, church arrives before family many of the times to the emergency rooms. And if they don't know what the family dynamic is or what the plans in place are, they're no help either. So I know emergency rooms will say families make decisions, but when the minister gets there and he shows the medical power of attorney or he shows the DNR,
Yeah.
that counts. And that is accepted by the hospitals from the ministers that are associated with the family. So keep that in mind also.
Thank you,
Thank
Teresa. I appreciate that.
Lots of presentation.
Thanks, Teresa. I didn't know that. And so kind of follow up with that, there was a question by Dale. Can a person have the DNR or their medical power of attorney already on file at a hospital like Baylor or Texas Health?
Yes, and it is amazing how long the the depth and breadth of information available is at the hospital. A couple of years back had some outpatient surgery, and they had my address from 12 years ago. And I was like, whoa. Of course, I was born in the same hospital, so I didn't ask him about, did they have that? But yes, you might have that on file, but it's best to be prepared and have it with you, or have it with your relatives, or as Teresa reminded me, clergy that might come into play.
And Leah, I was also going to mention, whenever there's any change, like I pulled it up while you were talking and went, when was the last time we updated ours? Well, we've moved. Our address is new. Well, Mother's Day is this Sunday, and my family's going to sit around the table and fill out some paperwork, is what I know, because we're all going to be together. And we have always had our paperwork done, but we've got 3 people with 3 new addresses. Print it out today. I love what you're saying. Do it today. Do it now. And this weekend, you might be getting together with family.
Yep.
About it.
Chances are. Thank you. I did bring up, what is the next holiday? Thank you for reminding me that it's Sunday. And, in addition to getting the gift from mom, this would be helpful too. Somebody has moved. This would be a great way to update the forms. Teresa asked about most or post, and those are forms that are credentialed by state or other entities. Texas is going with the most form. It's not a Texas state form. It's just most people are using the most. So we are planning to incorporate the most in our registry. And one of the ways I've thought of communicating that to the public is Texas Cares Most. That might be a good way to encourage people to fill out the form. So that is the form that we're going with. How to incorporate it into the EHR, we're working through that. So.
And what is the most form?
Ollie, do you want to explain that? Or Teresa? Take a stab at it.
I can give you 1 second.
Oh, well, it's a form that actually contains the directives in a very succinct manner. It's usually pink. It stands out, and it basically lists your ACP plan in a very short, concise way. It says, wants comfort care, or no, wants particular modules observed, or wants everything done. So that way people know what it is that the patient wants. So we can include a copy of that in the PDF that we send out to people.
I have one more thing to share. The most is Texas is putting it as a challenge to doctors to encourage facilities and individuals to complete the most. Number 2, when you want to have these things on the medical records, you would send them to the hospital of choice that you use and to the doctor, initialing it to go to medical records. They do not accept the out of hospital do not resuscitate, the DNR, because that's just an order in a hospital. So they won't put that on your chart. And once they're on the chart, you can't get copies of that from the hospital. One thing that I have run into several times over my years as a social worker is these forms shouldn't be locked in the family safe.
Yeah.
It's not a will. It's not got to do with property. It needs to be accessible to all of the family. We have families that come in and they put the vaccination cards in the safe, and then the mom has dementia and can't remember the code. Or more than one person is involved in a situation and nobody knows where the other people have put their forms. So making sure that family knows what your wishes are, where the documents are, how they're kept at the house are most important. Not to use that word too much, but
well, and thank you for bringing that out. We are also, that reminds me, we're working with Texas Cares, which is the organization that is working to encourage physicians to use the MOST form. And they are being involved in the process of putting the EHR together online in our new portal. So thank you, Teresa. You're going to be invited to all of my presentations in future. I appreciate that. It's a good spotter role. I usually have Karen to help me, you know, stay on the beam, but glad you're here.
Leah, I want to give a shout out for all that y'all are doing from the hospice nurse perspective, and the last 8 years in hospice, having families that have made these decisions and had these conversations. It makes a tremendous difference in the end of life care and the levels of stress for the family members. I was just thinking, as you were talking about no matter your age, you need to make these preparations. And I think some of the hardest circumstances I've dealt with is when I'm talking to a 21-year-old who is having to make these decisions for their 45-year-old mother or father that they've never talked about this with. And that really happens. And so what you're doing is really valuable, and we're thankful.
Well, thank you. We always say it may be a little bit difficult now, but it'll help a lot in the long run. Just face those fears and do it. Just brave it. Just have the conversation, say what you need, say what you want. It's just going to make it so much easier in the future. A little pain now, a lot less later.
Are there any other questions or need clarification on anything from anybody?
Well, we always say that it's always too early until it's too late. So again, you're the only one that can do it. Make the decision today, choose your champion, get that paperwork, that documentation, and then have the signing party on Sunday with mom.
Love that. And if you ever have any questions or anything, we'll make sure to include the resources from Care and Prepare in the email and a link to their website as well. But y'all are doing big work and good work. So
thank you, Jamie. We couldn't do it without you guys. We appreciate your partnership.
Yeah. We'll be looking for our follow-up email this afternoon, and we appreciate everybody for being here. Leah, thank you for the content, and hopefully we will see you all next Wednesday at 11:30. And Holly will be talking about hospice and everything you want to know about that conversation. So
Awesome.
see y'all then. Bye.